Okay, so we're going to go over the um, bronchial tree model. So here we have the trachea, which branches off into the right and the left primary bronchus. And then we have the superior lobar bronchiole and the inferior lobar bronchiole on the left side. The right side would have a middle lobar bronchiole if it were here. And then we have the tertiary or segmental bronchi down here. All right, we're going to go over the blood flow through the heart. So red blood cells are going to enter the heart through the inferior or superior vena cavas into the right atrium, through the tricuspid valve into the right ventricle, through the pulmonary semilunar valve to the pulmonary trunk, to the pulmonary arteries, where they travel to the lungs to become oxygenated, and then back to the heart through the pulmonary veins into the left atrium, through the bicuspid valve into the right ventricle, and then through the aortic semilunar valve into the ascending aorta, the aortic arch, the descending aorta, the thoracic aorta, and the abdominal aorta. From there, the blood goes into circulation. All right, we're going to go over the structures of the heart. So here we have the apex. Up here we have the base. Surrounding the heart is the fibrous pericardium. Below that is the serous pericardium, which contains the parietal pericardium, and then the pericardial sac, which contains serous fluid, and then the epicardium, which is the outside layer of the heart. And then we have the coronary arteries. So over here we have the left coronary artery, which is divided into the circumflex artery and the anterior descending artery. And then here we have the right coronary artery, which branches off into the marginal artery and the posterior descending artery. And then we have the coronary veins. Here we have the great coronary vein, the small coronary vein, and the middle coronary vein. This yellow here is the interventricular sulcus, the coronary sulcus, and then we also have the coronary sinus where the veins drain into. And then here on the aortic arch, we have the brachiocephalic artery, which branches into the right common carotid and the right subclavian. Then we have the left common carotid and the left subclavian. And then on the inside of the heart, we have the myocardium and the endocardium. The atrioventricular valves have the chordae tendineae, which attaches to the papillary muscles. And then on the inside of the ventricles, we have the trabeculae carnae. On the inside of the atrium, we have the pectinate muscles. And in here is the fossa ovalis. Oh, and right here we have the ligamentum arteriosum, the interventricular septum, and I think that's everything.